Good morning, all day. So today we will be discussing a very common problem which is there nowadays. Every household or every neighbor is suffering from this disease. So to discuss and bust our myths, we have with us a very renowned ophthalmologist of the state, as well as he's a very local doctor to you because he's next door to all of us here at Notre Dame. So we will be discussing about the common problems with Dr. Banka. Welcome, Dr. Banka, please. Sir, on behalf of the PTA and the Student Council, I'll be asking few questions. Sir, what is this eye flu, the common eye flu that is going on all over the country?
First of all, I would like to thank Sister Neha, the principal of Notre Dame, and the PTA for inviting me here and talk to you about this raging epidemic which is affecting all of us, which is viral conjunctivitis, or commonly known as the eye flu. Now, to understand what is eye flu, first we should know what is the conjunctiva. Conjunctiva is the outermost transparent layer of the eye, which covers the inside of the eyelids and the white part, that is the square of the eye. Now, it's a very highly vascular structure, and it has got a role in protecting our eye and making the tears or secreting the tears and keeping the eyes moist. Now, whenever it gets inflamed, we get this condition which is known as conjunctivitis. And this conjunctivitis can be of varied etiology. It can be infectious or non-infectious. The kind of conjunctivitis or the eye flu which we are getting around nowadays is of infectious etiology, mainly viral, and it is highly contagious. There are a few known viruses like adenovirus, which is the most common cause of this viral conjunctivitis, which infects the conjunctiva, causes inflammation and causes this condition, which is the viral conjunctivitis or the eye flu.
Thank you, sir. So I think we get some insight into what is conjunctivitis or what is eye flu. So can we know how does it spread? I mean, I've heard it is very contagious. You said that. So how does it spread, sir?
See, first, the most common myth which is prevalent in the society is that it spreads by looking into the eye of the patient. That is absolutely untrue. It doesn't spread by looking into the eye of the patient. The transmission of eye flu or viral conjunctivitis is mainly hand to eye, or sometimes due to direct inoculation of the conjunctiva with the infected respiratory droplets. By hand to eye, I mean if a patient of eye flu touches his or her eyes, and then we shake hands with him, or share towels or napkins, or share pillow covers, or sometimes even if I suppose I'm touching my eyes and I touch this disc, and somebody else touches the disc and touches his eyes, then he may get the infection. So it's a fomite-borne infections, or can be transmitted from hand to eye, then eye to hand, and then again hand to eye. So that is the cycle of transmission. It doesn't spread by looking into the eyes of the concerned patient.
Thank you, sir. So that was very important for all of us to know that it doesn't spread by looking into the eyes of another person. So social duty to banani hai isme, I agree with that. So sir, one more myth that I would like to ask you here, that why do people wear sunglasses or black glasses or something cover their eyes? What is the need for that?
As such, it has got no role in treating the eyes. But yes, we can say indirectly it helps, because one condition which affects, which happens with conjunctivitis, and that some patients may get photophobia, that is light sensitivity. So if you wear black glasses and you go out in the sun or even in the ambient room lighting, patients will not be, if they are wearing goggles, will not get sensitive to the light. That symptoms will be controlled with the help of black glasses. Another role which glasses can help is that if a patient is having conjunctivitis, the glasses can act as a barrier, and it will remind the patient of not touching his eye and then inadequately spreading the infection. But as such, there is no therapeutic role of protective glasses in a patient of conjunctivitis.
Thank you, sir. So therapeutic role means no treatment benefit is there, I guess. So it is help just prevent loss infection. That is what I can understand, and I hope everybody else will understand. We'll have the questions in the end. Sir, are there any ways we can prevent it or stop the spread, like any other viruses?
As I had discussed earlier, that it is a very contagious disease, and right now we are seeing it in epidemic proportions. Every household, every other person is getting infected, and once a person in a household gets infected with it, others in the family are also getting the same infection. Now, it is very important that since this is a viral disease and it has got no, you can say no cure, it is a self-limiting disease, but it has got no cure, no medicines will help in stopping the spread or decreasing the course of disease. So it's very important for us to understand that how can we cut this chain of infection, how can we stop the spread of infection. Since it's a fomite-borne disease and it spreads by direct handshakes and all, the most important thing is that a patient who has got this infection should, I will not say that 100% confinement or quarantine, but yes, should stay away from others, should not, the most important thing is that one should not be touching the eyes again and again. Even for the patients and other people, like we who are not having the infection currently, but if we tend to touch our eyes, I can see many people rubbing their eyes right now in the audience also. And because of all this digital strain and all, the tendency to rub the eyes is increased. So if we stop touching the eyes, we will not be spreading the infection to ourselves. And if we are not touching our eyes, we will not be spreading the infection to others also. The most important thing is that don't touch your eyes. Apart from that, patient who is having conjunctivitis, viral conjunctivitis, they should not be sharing their towels, their napkins, the pillows, their clothes should be washed separately, should not be washed in the house with touch any other part of your body. Definitely, if somebody is visiting a hospital, the chances of getting any infection is high, because normally you have infected patients there, the environment is carrying a lot of microbes, so definitely the chances are there. Very unlikely to get a recurrent disease of this adenoviral conjunctivitis, but there are known cases where recurrent infections have occurred, mostly in patients who have immunocompromised due to either steroids or some HIV infections or uncontrolled diabetes. But mainly it doesn't recur. Most of the patients do get immunity. And the immunity occurs, immunity is there for quite some time mostly, because I can tell you that this epidemic, I am seeing this epidemic almost 8-9 years later. It normally occurs in this rainy season only. And the last epidemic which I remember of this adenoviral conjunctivitis was in September 2014. So it's been almost 9 years since this epidemic has occurred. So the immunity lasts for quite some time.
I think there are no more questions, and it was a very intellectual discussion by the audience as well. So thank you, Dr. Banka, for such a responsive. I would like to thank Dr. Banka for clearing all your doubts and giving such important, useful inputs to all of us. I think by the end of the discussion, the take-home message for all of us would be that we should restart re-emphasizing the practice of hand wash as we did in COVID times also, because for prevention of any viral infection, I think hand wash is the most important step, because as sir said, throat over face, you don't know when the person is going to become infected. And I think that's the take-home message from all of us. The preventive part, treatment part and other parts of the disease have been discussed well.